And I am happy to introduce our first live speaker, Deputy Mayor Judith Thomas. She started about 6 weeks ago in the mayor's office, and I met her Thursday and enjoyed talking with her. As you know, a job up on the 25th floor, working for you, with you, is a tough job. So as you meet her over the next few months, be supportive, and she will be supportive of our city. So with that, Deputy Mayor Thomas, you can come to the floor.
Hello, everyone. Good afternoon. So excited that it's sunny out and that it is springtime. Just feel the change in the air. And having been at the job for about 6 weeks, I've been going in strong in meeting a lot of people in the neighborhoods and working closely with the people that I will be working with in the mayor's office. So in my new job, in my new role, rather, as Deputy Mayor of Neighborhood Engagement, there are several departments that I will be working closely with. So I'd like to give you an idea of who I will be working with over the next few years, as well as the community outreach. So, of course, I'll be working with the mayor's neighborhood advocates. Very excited about that. I have met one-on-one with most of them already to understand the areas that they're working with, the very strong, active neighborhood organizations within their areas, as well as the leaders within their areas. And I have met some of you already. I've even during this COVID time, we've safely masked up and gone around various neighborhoods to get a feel for where developments are, where people are looking to make change and where change is needed. So I'm really excited about working with the M&As, as we call them, and connecting them to resources that can help them better do their job, and also connect community organizations to resources that maybe they aren't aware of, or to enhance those relationships. I'm also working with the Citizens Police Complaint Office. We are currently looking for a new director for that particular office, and looking at streamlining that process of people that have would like to make complaints within the police officers, within the police department, and also be able to make sure that it is streamlined so that it's easy to use and to communicate those challenges, and to make sure the processes work for the citizens in understanding next steps. Also working with the Office of Minority Women Business Development, a very strong department, very focused on making sure that MBEs and other business and minority businesses, women businesses, veteran businesses are certified, and working with the city and working with other corporations within the city to make sure that we raise the game for everyone in the world of business and ownership and entrepreneurship and opportunities. Also working with the Office of International and Latino Affairs. This city is becoming more diverse day by day, so we must understand the needs of the citizens and people that are coming to Indianapolis and what resources are needed. I have, in the short time I'm here, realizing the importance of language access, not only for our Latino community, but also for Burmese, French-speaking people that are coming in. How can we make life better for everyone? The city is only going to grow in the future, and how can we connect people to resources, and also celebrate the culture, the various cultures that we have here. Looking at the Sister Cities program and how we can develop that and how we can celebrate that, and all that uniqueness and diversity. The veteran services, they're veteran service officers that can help veterans and connect them to services that they may not be aware of, realizing getting educated on that, knowing that my husband is a veteran, a 30-year firefighter who just recently retired, but is also a veteran from the Army, and realizing there are services that he wasn't aware of. So signing him up for that, and also telling that story around the city, as well as working with the arts and culture community. Of course, I come from a background of hospitality, as well as the arts and culture world. With my previous job being a consultant in the arts and culture community. I called myself a cultural architect, but then also before that being the president of Madam Walker Legacy Center and the lead on Avenue Cultural District that we're hoping to still be able to develop in ways that it should be developed, and communicating with the neighborhood and the folks in the neighborhood to understand what those needs are, and really working to make sure that they are a part of the process, which should be the case for every development in this city. So I'm all about listening, about inclusion, and really listening to understand what people need. And then also being able to connect and partner and collaborate to make a project or a need fulfilled and successful. And then that's all about empowerment of how we can make it happen, how we can stick with it and understand what we all need and what the reality is and what those resources are to make sure that we're all successful. So I'm very excited to work with the neighborhoods. I'm hoping that we're coming out of COVID soon. Of course, I did get my shot yesterday, my first shot at the Urban League, and really miss being able to interact with people and really get to see faces and get to know people so that we can discuss and figure out what is needed. So that is my hope for the next few months, to be able to physically meet folks. I am now taking a lot of meetings back to back to back because I want to meet as many people as I can and understand what those needs are to be able to connect folks to what they need and those opportunities, and to see what resources are here at the city that can also assist. So I truly love being a part of this. Can't wait to actually meet and see everyone. And my goal in the next couple of months is to actually go physically see neighborhood associations and groups and projects, and just keep the mind going to see where I can connect. So thank you so much for having me here today. I can't begin to tell you how excited I am to have been chosen for this role, and feel that all that I have, I will give my energy and heart to it. So thank you so much, and have a wonderful rest of the meeting. I plan to sit in on it. I love Dr. Caine. I just had a Facebook Live discussion with her about COVID and the resources and dispelling the myths about COVID, and really just trying to get the entire community involved through our community ambassador program as well. That you can go to the indy.gov website to sign up to become a community ambassador, to be able to spread the word to your communities to get out and get vaccinated. So thank you so much for having me. I truly appreciate it.
Thank you, Deputy Mayor. I think we all agree with you. We want to be back out in the world and in the neighborhoods during this coming year. And so Dr. Caine is with us, but I have a person introducing her first. Her name is Kenzie Isaac. Kenzie is a public ally with us at INRC. And so Kenzie, can you come to the floor and introduce Dr. Caine?
Thank you so much for that introduction, Maury. Hello, Dr. Caine.
Hey, how are you?
I'm doing well. How are you doing?
Good.
Excited to receive your insight this afternoon. So when many of us hear the name Dr. Virginia Caine, our minds immediately summon an image of a lifelong champion for health equity, particularly by way of Dr. Caine's work as director of the Marion County Public Health Department. And while this image is indeed an accurate one, my mind actually instantly returns to the first time I witnessed you, Dr. Caine, in action. It was March 2015, and she was a keynote speaker at the Scholarship Gala for college-bound Black youth in Central Indiana, put on by the Center for Leadership Development. As I sat in amazement of Dr. Caine's accomplishments and commitment to the city of Indianapolis, I was equally stunned by what she represented, and more specifically, who she represented. She balanced her thriving medical career with her equally crucial roles as community member, scholar advocate, and educator. And she did so unapologetically as a Black woman who pressed for community-informed healthcare justice for countless others with marginalized identities. She represented possibility. She represented shattered barriers. she represented and continues to represent young, aspiring healthcare advocates like me. Throughout her career, Dr. Caine has paired representation with action. A graduate of New York Upstate Medical Center in Syracuse and a former infectious disease trainee at the University of Washington, Dr. Caine has attained national recognition for her specialized work in all clinical aspects of AIDS and sexually transmitted diseases. Her expertise and insight have been called upon by the Centers for Disease Control and Prevention, the National Institutes of Health, the Office of the Secretary of the U.S. Department of Health and Human Services, and the National Medical Association, where she served as the chairwoman of both the Infectious Diseases Section and the association's Board of Trustees. An exemplar of how to use one's national platforms to make local impact. Dr. Caine led a county-wide process with local primary care agencies to create the city's first integrated HIV healthcare delivery system. In addition to this work, she was principal investigator for the Ryan White Title III funds, which established the first AIDS clinics in major city hospitals, 10 community health centers, and resources for community-based HIV/AIDS prevention programs. Through her tenure as a professor at the Indiana University Schools of Medicine and Public Health, Dr. Caine has authored numerous clinical research papers and contributed to book chapters on the various aspects of communicable diseases, demonstrating just how far her healthcare justice-oriented scholarship has extended. And amidst her work in the biological transmission of diseases, Dr. Caine's position within the Marion County Public Health Department has also led her to investigate the social transmission of health behaviors and the social processes that underlie the city's most jarring health inequities. As co-director of the Indianapolis Healthy Babies Initiative, Dr. Caine worked alongside community advocates to reduce Indianapolis's Black infant mortality rate, at one point the highest rate in the country, to its lowest level ever in the history of the city. This, of course, is not to mention all of Dr. Caine's tireless work mobilizing critical policy and systems-based knowledge throughout Indianapolis, most notably to the city's communities of color during the ongoing COVID-19 pandemic. Now it is my privilege to yield the floor to Dr. Virginia Caine, who is Neighbor Power Indy's keynote speaker. Welcome, Dr. Caine.
Well, thank you. I'm so honored to be here, and I just would like to thank the sponsors, Maury, and all the others who have selected me to be the keynote speaker. Let me just tell you, it is so clear across the country that neighborhoods and what happens in those neighborhoods are what makes cities great and motivated and strategically and economically know how to positively impact their environment. And that wouldn't happen without a lot of the leaders that are in this room, trusted community folks who are doing the best and accomplishing just tremendous, outstanding achievements in your respective areas. So it's always an honor and a pleasure to participate with some of the finest minds in terms of, in this 21st century, how we motivate and progress to be the communities that we want to be and being the best that they are across the country. So what I thought I'd do today was sort of give you a little chat, even though it's not by the fireside and it's not winter, because I'm so grateful for this warm weather. I thought I'd talk a little bit about what's happening related to this COVID crisis of ours, and just some information about the vaccines that are now rolling out across the country. And then I would touch a little bit about March Madness that's going to be happening very soon. And then lastly, just commend on what I think it's going to look like post-pandemic. And when might we see that happen, and what would it look like? So I'm going to first start and talk about the COVID pandemic and how is our city faring right now. So there are two measures that we look at that determines how much community spread we have in a community. One of them is something called a positivity rate. This measures the percentage of people who have COVID-19 in a respective community. And what we say is the gold standard is if you have 5% or less, greater than 2 or 3 weeks, it means that you're doing a fantastic job in controlling your community spread. We were as high as 16.4% back in late Thanksgiving in December. The highest, though, we were ever in terms of our positivity rate was almost about 25 to 30% way back in April at the start of this epidemic. And we just are having our first year anniversary from our first case that occurred in March of last year. So the other metric we actually use also as well is something called the daily number of cases that are reported each day. And based on a 7-day average, what is that percentage? And so our gold standard is trying to get to 35 cases or less. So I'm happy to report that yesterday, our positivity rate was at 3.2%. We're almost at the 2-week mark, being less than 5% positivity rate for COVID-19. But when we're looking at our cases, when we were experiencing greater than 1,000 new cases twice in the month of December, and mostly 900 cases a day, 800 cases a day, I am happy to say that we are down to 91 cases a day. And so we're getting close to that 35 cases a day. So we met one metric, but we need to meet the second metric, but definitely doing remarkable in a great manner. And if you looked at our number of cases compared to our surrounding counties, we have some of the best positivity rates in the daily cases compared to any of our surrounding counties, with maybe the exception of one. So for a population density based on the size of Marion County, we're just doing a remarkable job. And I do want to thank our Mayor Hotsett for the wonderful leadership he is extending and making sometimes tough decisions. But at the other side of coin, we have to be very careful in balancing our processes from an economic standpoint and an economic stability. So that's our status for COVID-19. We're looking very good right now. We also look at the number of schools that we have. We have like over 300 and some schools in Marion County. And when you look at when we first reopened schools, is it safe? Well, we do a tremendous amount of data analysis. We get our primary data through our Indiana Health Information Exchange, through our Regan Street Institute that is well known from a research data standpoint, and our Indiana University Fairbanks School of Public Health, along with the State Department of Health reported data sent to them as well. And when we look at that data, it was clear that from K through 12, after looking at it very carefully and monitoring our data since school started in September, that we were seeing considerably less transmission in our schools compared to community spread. And so we try to identify how many schools are in what we call the red zone, where their cases are going up, and we need to probably provide some technical assistance in order to help get those numbers down. When our schools reopened, we had a total of 14 schools that were in the red zone. I'm happy to say we're down to 7 schools and making tremendous progress. And we have no schools in the orange level, which is the level just before you get the red zone. So out of 300 and some schools, and only it looks like maybe 7 schools having some issues, that's a tremendous accomplishment. And I have to just commend all of the leadership with the school systems, the public schools, the Catholic schools, the private schools, and the charter schools. The leadership from the top has just been outstanding. Our teachers and teacher staff have just been incredible. And we just appreciate the parents and legal guardians just being so appreciative related to that arena. So we're looking great in the school settings compared to maybe across the other larger communities in other cities. Now let's talk about the 3 vaccines. And there seems to be some slight controversy about, are any vaccine better than the other? Which one should I take? How do they differ? We just had the Detroit mayor this past week said he didn't want the Johnson & Johnson vaccine because he didn't think it was as good as the first 2 vaccines that rolled out, which was the Pfizer vaccine and the Moderna vaccine. So both Pfizer and Moderna, Pfizer rolled out in December, Moderna rolled out in January. Both of those vaccines' clinical trials showed that they had an efficacy of 95%. And Moderna prevented 100% hospitalizations, 100% deaths. And so it's really unheard of. Most of our flu vaccines efficacy are between 60 to 70%. And yet Pfizer and Moderna had a 95% efficacy. And then what popped up, our most recent vaccine that just came out this week was the Johnson & Johnson vaccine. And so a lot of people had some concerns because the efficacy was around about 72% overall. If you looked at the clinical trials with Johnson & Johnson compared to the 95%. But when you looked at the data from Pfizer and Moderna, that 95% clinical trials was just predominantly in the United States. When you looked at Johnson & Johnson's vaccine, that's 72%, their clinical trials included a lot of people from South Africa, a lot of people from Brazil. So they did their clinical trials, over about 50% of them were in countries that already had what we call the resistant mutant strain of COVID-19. So their vaccine was actually done primarily in a lot of countries where the strains had already mutated. So that if you had to put Pfizer and Moderna in those countries where the virus had already mutated, it might very well be as low as the 72%. And when you looked at the Johnson & Johnson vaccine and just looked at the people that were in the United States, their efficacy was 86%, where 86% never, they didn't get moderate or severe disease. They didn't get hospitalized. Sorry about that. They didn't get hospitalized, nor were they in the intensive care unit that occurred as a result of the infection. So basically, you really can't even compare them unless you do a comparison side by side. So I was honored to get the first Johnson & Johnson vaccine on Thursday. And I was left with a little, sore arm for about 24 hours. I took a little Tylenol the next day, and within 30 minutes, the soreness and the pain was gone away. Now, I know there's been some discussions about, well, you know what? I'm just going to take my chances, and I'm not going to get this vaccine because I'm just concerned about this vaccine and should I take the vaccine? 10% of people who experienced COVID-19 develop what we call the long haulers syndrome, meaning that they have long-term complications related to getting COVID-19. And some of those long-term complications and symptoms can be frightening. I think the number one that I hear the most and people are very concerned about is they lose their memory. They get brain fog, F-O-G, like you're driving and it's real foggy out there, sometimes early in the morning. So they get a brain fog where their memory is not good. They have difficulty calculating just everything, every day kind of things. You can go to a grocery store and give someone $20 and you can't even calculate what your change should be. Or this person was your best person in your wedding and you can't remember their name. Or was your roommate in college, they look familiar. So people don't seem to have the same intellect, mental capabilities that they had before. And this brain fog is lasting weeks to months. Now, another major complaint people have is they get this what's called chronic fatigue syndrome. They're so exhausted just getting out of bed in the morning. It's a chore for them to even make it to the restroom in their house because they're so tired. And this is not one where, wow, I got a few good hours, I got a lot of energy, no problem, and then I'm exhausted where it's alternating. No, this is chronic, and you're exhausted throughout the entire day. And you get to the point you're so exhausted, you can't even do like everyday work related to your employment. A lot of people are not able to even work because of the chronic fatigue syndrome. It can also impact your heart. We now know that this virus can cause an inflammation of your heart called myocarditis. And what happens with this damage to your heart muscle over time, your heart can't pump like it used to. So it slowly loses the ability to pump out the blood out of your heart, and you get what's called heart failure. And usually we used to see heart failure people primarily in their 60s, their 70s, but now they can experience heart damage earlier, or they may see all of a sudden heart arrhythmias, different fast heartbeats all the time, their chest pounding, chest pain. And because it can also cause pneumonia and it impacts the lungs, some people are left with chronic shortness of breath or difficulty breathing. And lastly, it can impact your kidneys. You can lose your hair, and you may lose the loss of taste and smell, where it may be for weeks or months. When I say loss of smell, if you left a pan on the stove and it's smoking and burning, you couldn't smell the smoke. Loss of taste, now that might not be a bad thing, for those who are trying to lose some weight and maybe you can't taste something, so you'll be able to eat a balanced meal now instead of being excessive maybe sometimes when you eat. I don't know what happened to me, but I know after the age of 30, food started tasting so much better. I paid way more attention to it by taste compared to before the age of 30. So hopefully that didn't happen with all of you. So it's those 10% that are left with long-term complications where if you get a vaccine, your symptoms usually last, the average, between 18 hours to 48 hours. That's on the average, okay? The majority of the people, their symptoms will be gone in 2 days. So take it from me, get that vaccine. The other thing that's really important, and people don't realize this, there is no live virus in the vaccines. So there's no way you can get COVID-19 from any of these vaccines. No live virus. What they did was genetic coding or sequencing of the virus, and they made a man-made product, part of that product, in order to make the vaccine. So it's all man-made materials, no live component of any viruses in any of the vaccines, and they cannot alter your DNA of your body in any way. It never makes it into the central part of your body cells. Now, other people complain about, well, this technology is too fast. It's just taking too long for this virus. I'm really scared about it because we don't know enough about it. So actually, they're using a component called messenger RNA that's in everybody's body and all of your cells. You have a messenger RNA. And they've been doing research for at least 10 to 12 years on messenger RNA, just waiting for when we could have an actual clinical trial using this platform for humans. We've always done a lot of animal models before. So this is not something just new, but it's the first time we've been able to use this technology for clinical trials. I have to say that for any African Americans, one of the leading scientists from NIH was a Dr. Corbett, an African American female, 32 years of age, but had been working at NIH in the summers of high school all the way through college, and finally got hired and has been with NIH now about 8 years, officially employed as a scientist. And she's hired by Anthony Fauci, and just a very incredible, smart person who I feel strongly want to bring back something for her community. So she's doing a worthwhile work in a lot of work. Now, you know what, we couldn't do without research. And I know some people have been concerned about the Tuskegee syphilis study. That was the study where medication was withheld. So they weren't given something that was terrible and they had bad side effects. The Tuskegee syphilis was when they had a treatment, they had a cure, which was penicillin, that they did not offer it to the men. Men were thinking they were getting treated, the 600 men from Tuskegee syphilis, but it was withheld even 30 years after it was available to them in order for the scientists to see what were the long-term effects from having syphilis, which caused significant brain damage, caused significant heart disease, and left us with a lot of congenital syphilis babies that had deformities and spread through 4 generations. I'm happy to say that it's very difficult for that to happen in this day and age now, because so many safeguards, what we call internal review boards, located at all academic institutions, different big entities such as ourselves, that they review now these clinical trials. You have to have informed consent about the real thing. And if you risk violating it, if you're an academic center, you're talking about, easily over hundreds of millions of dollars if there was a violation. So we feel pretty comfortable now about clinical trials, and so very, very happy with that. So, hey, Indianapolis Motor Speedway, is open today, tomorrow, 8 to 10 p.m., Monday. Get your vaccines. Any teachers now are eligible for vaccines only in the federal sites. Any teacher, no matter what your age, in the federal sites, you can get vaccinated. That's Walmart, that is CVS pharmacies, and I believe Myers. Those are the 3 federal sites where you can make an appointment with them and get vaccinated. Walmart's also doing a partnership. We just heard Ms. Thomas talk about she got her vaccine yesterday at Urban League. So Walmart's doing a partnership with the National Urban League at their address on Indiana Avenue. So they're open for getting shots as well. And on Monday, so please continue to get your shots. Our health department, we offer vaccinations Monday through Saturday. We end it, though, today at 1 o'clock from 9-11 on Saturdays. It's appointment only. So remember, our shot, that's one word, OURSHOT.IN.gov, where you can register online. And if you kind of have some techie difficulties or you don't have internet, you can call 211. AARP will help assist you in making setting up your appointment by telephone. You know, if you can't do it online, and of course the Indianapolis Speedway, you know, if you haven't, it's a drive-through process where you can get your vaccination while in the car and they observe you. So don't want to miss any of these opportunities if you can. Monday, Wednesdays, and Fridays, we're open to 8 to 5. Tuesdays and Thursdays, we're open to 10 to 7 p.m. And Saturdays, 9 to 1 p.m. So look to see us doing some pop-up vaccination sites, especially trying to reach our hard-to-reach individuals, some of our racial and ethnic populations where the vaccination rates are low. So important to reach them in regard to this epidemic. And so don't forget, someone loses their taste or smell, that's COVID-19 until proven otherwise. Thank you. So let's go to the next phase. And that is the March Madness. And so we're going to have a tournament of about 68 people come for the finals for the men's NCAA championship held here in Indianapolis. And they have one of the most stringent protocols that I've ever seen from an infectious disease standpoint for the players, for the coaches, any of the staff that are coming here. They will be in what's considered a bubble. A bubble means that all these wonderful young men and the talent that they have, they unfortunately will never be able to see Indianapolis like we will see it, because they will be in a bubble. Trying to turn my phone off. Sorry here. They will be in a bubble, meaning that they will be in a special hotel here where they'll stay, and they have this special new technology. The special new technology has sort of like a wristband around their wrist that can highlight whether someone gets within 6 feet of you, and it tells you how many minutes they are within 6 feet of you. And our standard is that if someone is positive and another person comes within 6 feet of you and it's greater than 15 minutes, then you've had enough exposure where you're going to have to self-quarantine and isolate for a period of 14 days. So they will have this device on all of the players, all the staff, so we will know that. And because they are in hotels, they'll be escorted to the convention center with really strict rules where they don't come in contact with any other team until they're actually playing that team. And they will have their food served only in the convention center or in special locations in the hotel where they have no exposure whatsoever to any of the hotel occupants. So this is what they call a bubble. So from the time they're here until they leave, they are under really strict infection control. And because there's 68 schools, a lot of times, once that school is played and they have lost, usually they will leave the city within 24 hours. So we will have spectators. I don't know what that amount is. I don't believe that the NCAA has announced how many spectators that they will be. But based on our criteria from our public health orders, we're not allowing any more than greater than 25% capacity who can come to our city as spectators. And I know we're having different sites, especially Bakersfield House, Lucas Oil, the stadium. So a number of sites locally occurring here, but we feel really good about the process. A lot of our hospitality folks downtown, our hotel folks, our convention center has just been doing a tremendous job. Restaurants getting prepared for this. Our health department is going to step up our inspections because it's so critical for people to be wearing their masks, doing their social distancing related to this. And so we want to make sure that people are continue to be in compliance. We're having heavy discussions. We will be having heavy discussions with the hospitality associations, bar associations, and other entities to really make a special effort in terms of following infection control measures. And so Big Ten is coming here too. And so it depends on whether any of our Indiana schools, how good they are in terms of whether they'll be around for Big Ten versus they'll be around for NCAA. And so we'll look to see those individuals as well. And the Big Ten ladies and the Big Ten men are going to be here. So we're excited about all of the teams appearing in our city, especially from a economic boom. It's going to be phenomenal. Now, what do I worry about the most? You've got to always worry about the virulent mutant strains. That's critical because we don't know just how resistant they are. And two of the vaccines, Pfizer and Moderna, may require what we call booster injections. So they may have to get a third shot in order to protect us from the resistant strains. We know that the Johnson & Johnson is at least 66% effective against the resistant strains. So that's a good thing. But we need to try to get people vaccinated as quickly as possible. The Johnson & Johnson was supposed to have produced 20 million vaccine doses this month, and they only came up with 5 million at the beginning of the month. We're hoping that they will get 15 more by the end of March, but we don't know. But I will say that it looks like very likely that we will get at least 100 million doses of vaccine in the month of April. So that's when I think you're going to just see tons of vaccines are going to be available. And so will we have the capacity in order to get that vaccines out quickly? Because Pfizer's partnering all of these companies now, because they can't make it on their own in a fast enough quantity, are now partnering with other pharmaceutical companies like Merck, Sanofi, and some others in order to make and assure ourselves that we're going to have enough doses to vaccinate everybody. And I know that President Biden said that by the end of May, he will have enough vaccine for everybody. I think that we have to, for herd immunity, that means you have to have so many people vaccinated that even if you have some of them uninfected, it's not going to cause any large outbreaks. And we've got to, for herd immunity, vaccinate 80% of the people, 80%. And there's a total of about 360 million individuals in the United States. So wrap your mind around 80% of 360 we need to have vaccinated. So far, Marion County has 970,000 population. And we've vaccinated maybe only 10% of the 970,000 population. And I'm just going down to the age of 70. I don't know anymore. I don't have the data yet for the 60 to 70-year-olds. But if you looked at the 70 to over 80, we've vaccinated about almost close to 10%. So we still have quite a ways to go in Marion County. I also say that when we look at vaccinations in Marion County, the last recent data show that we may vaccinate 63% of residents in Marion County, while the other 37% residents, they're from another county. So we have people come from South Bend, Fort Wayne, Evansville getting vaccinated in Marion County because they can get an appointment quicker and get their vaccine. So it makes it a little bit more challenging for us if almost 40% are being vaccinated for residents outside of Marion County. It's going to take us longer to get to our 80% herd immunity. Now for the question that everybody wants to hear about, and that is, when do we think we can get close to being back to normal? Well, the big question is, can we stop wearing masks, okay? And, we can work on the social distancing, if you're in a grocery store or, or in some commercial setting or whatever. And maybe you're in a large a wedding party or people putting on some social gatherings. When can we look forward to getting close to back to normal? I think we won't see that, honestly. With a conservative estimate, I would tell you that's going to happen sometime in August this summer. But if we're very aggressive, if we're very efficient, we have the ability of getting everybody vaccinated, at least 80% of Marion County, probably by the end of June. Only because it's been so much slower for us to get the vaccines in the quantity that we thought we were going to get. So I look to see sometime in the month of June that we can start to feel comfortable about, hey, I don't think you will have to wear a mask. And so if I can get 2 good months out of the summer, July to August, I think that would be wonderful. Now, there is some slight talk about should we be wearing masks just in the winter months to help cut down pneumonia and hospitalization. That's a question I think we have to look and think about. We do know that our children's hospital, they try to keep people with any infections from the community coming in, because, you know, a lot of these kids in these children's hospitals, cancer patients, you know, they're really immunocompromised, and it could result in a death for us. We still know that the age group with the most cases are with our young group from age 20 to 29, with the majority of them college students, with the most cases of all our COVID-19. If we break it down by race and ethnic population, then our Latinx population has the largest number of COVID-19 cases. You know, a lot of concern about some of them being undocumented and concerned they may be deported, having access issues. The second group is our African Americans, Blacks, and then our third group is our Burmese population, Asian population, that we're seeing the third largest pocket of cases. And so contact tracing means that I can interview you, find out who you've exposed, and get those persons to quarantine and isolation. I think that's important. Lastly, any of you going out of the state for spring break, that's probably the thing that scares me the most. Way more than March Madness is the spring break. And we have about 13 some states that their cases are so high that if you're going for about a week and living in any of these states, you can bring back so many mutant strains in the city of Indianapolis. Florida is one of the top 3, and I believe they rank #1 for having the most mutated resistant strains in the United States are occurring in Florida. So you've got to be very careful visiting Florida and bringing symptoms back, because these resistant strains back. Remember, 1/4 of Hoosiers, actually it's closer to 40% of Hoosiers, have no symptoms. They don't feel sick, they feel great, they have no idea that they are infected. But just from talking like this, little invisible respiratory droplets are coming out of my mouth. A wind may blow a few viruses out of my nose, and I can be in a room and those droplets will remain in the air about 20 to 30 minutes, and I can leave the room with somebody else who's right there in that spot where I was, and they inhale that air, they can become infected. And so always remember, individuals with chronic medical conditions, illnesses, they are at a higher risk for hospitalization, being intubated in the intensive care unit for weeks or months. And a lot of those folks, after it's over, they're left with what's called post-traumatic stress syndrome. They have a higher rate of anxiety, a higher rate of depression from being in that setting. So a lot of our work cut out for us. Now for our future. I think we're going to get back in the summer of not having to wear masks. We have to wear it right now, even though we're vaccinated, because we don't know if we are carriers of the virus, and we can still transmit it to someone else, but in fact, it won't cause any huge damage when we're exposed to coronavirus. The vaccine causes us to generate antibodies. This is protein substances. It's part of our immune system to fight off an infection. But it takes 2 weeks to develop those antibodies. And so companies like Lilly have some monoclonal antibodies. Another company, Regeneron, they actually make monoclonal antibodies. And so they'll give you this infusion of monoclonal antibodies that will last you long enough until your body's able to make its own antibodies. So some great drugs that are out there to help people from dying. Take a look at it and read about it. But our future, no mask, is probably not a bad idea to do a little social distancing. I think that's going to happen by the end of the summer, somewhere between June and August. I also think that COVID-19 is here to stay. We'll have it every year, just like influenza. Influenza causes deaths, causes hospitalizations, require you to be in intensive care unit and to be intubated. So I think that's what our life will look like. But I also think that you've seen a substantial decrease in flu because everybody was taking their flu shot. My goodness. And then with all the hand sanitizing, hand washing in our homes, in our work settings, it's just been phenomenal. So I'm going to stop right here and take questions, but appreciate what all the neighborhoods are doing to try to educate, help stabilize and support our businesses. And of course, we have to continue to do education, education, and education, because we need to have some good and smart policymakers to help us have those kind of resources we need to do in order to carry out our job. So I'll stop here and take questions, Maury.
Yeah, thank you, Dr. Caine. I learned a lot of stuff. So if you all have questions, put them in the chat. So the first comment was that was clear and informative. Thank you all. So that's good. Does anybody have any questions of Dr. Caine? Clearly, she is the most knowledgeable person in our community about these issues.
I know it takes a little while to kind of unpick her, so it just takes a little.
Yeah. Oh,
We do know, while he's doing it, we do know we're getting, I believe, about 100, I know we've gotten at least the last time $168 million from the stimulus package. So we're waiting. We want to try to prevent any rental evictions in areas. We want to help to provide some income for small businesses in terms of their survival to make sure that they can stay floated. So a lot of work in those arenas.
Okay, so one was appreciating your heart and intelligence that you bring to your work, but we do have some questions now. So
Okay.
how are the hospitality employees going to be protected from COVID during March Madness?
So that's unfortunately that's a tough question, and whoever wrote that question was very astute. I have tried to push for people in the hospitality arena, especially people working in the convention centers, especially our indie bus drivers, even our air traffic controllers, to get vaccinated, especially in light of March Madness. But I'm just one member of about over 90 experts that have been identified by the Indiana Department of Health to give them advice about vaccine allocation and distribution. And so it's going to be tough for those ones who are younger than the age of 50, unless they have some chronic medical conditions like cancer, leukemia, lymphoma, sickle cell, Down syndrome. I do know that we're going to have another round of looking at individuals with certain chronic medical conditions, meaning that it puts you at extra risk if you contract COVID-19 for serious complications. And so that's being voted on, and we'll have some new recommendations next week. But for a significant percentage of them, they will not be protected. And so they have to be very careful about making sure that they're wearing their mask at all times, doing that social distancing when they can, and hand washing.
Okay, thank you. So the next question is, will we need a booster shot if we receive the Pfizer shot?
So I don't know if you're going to need it or not, because what they're saying now is they're looking at both the Pfizer and Moderna in terms of the booster shot. They're also looking at if you've had COVID-19 before, because you developed some antibodies, you might only need one Pfizer shot compared to the traditional 2 doses. So we just don't quite know that answer yet from your original question that you asked me.
Okay, thanks. What COVID variants have been found in Marion County? Do you have any special concerns about that? And I know you mentioned it about people traveling.
Right. So I can only talk to you about the state. For Indiana, we have received 14 mutated mutants, and they are the United Kingdom. So of all of the mutated strains, United Kingdom is the less severe, less contagious compared to the South African one, which is the next worst strain, and then the Brazilian one, which I think is the greatest of all. So far, just in the state of Indiana, we've had only like 14 cases.
Okay, thank you. So what should we do if we see stores that have not been enforcing the mask mandate? Some people have seen that.
You have to just call the health department and report that store and give us the details of when you thought it happened. And usually we try to visit every store that we can. Now, people will tell me, well, I saw this person walking without a mask. And so, we can't always, for people walking without a mask, by the time we get there, maybe it's probably a day or 2 days later. It is sometimes difficult to do that. But we do have a project where we are monitoring mask wearing in different locations, trying to see if we can get a pattern or whatever where someone is really exceeding our recommendations.
Okay, so there's a question about antibodies tests. What is their reliability and what do they really mean?
So the only thing the antibody tests right now can tell you is that you've been exposed to COVID-19 in the past. What it does not tell you was how long ago. Because we're saying that if someone gets COVID-19, they are immune from getting another infection with COVID-19 for about 90 days. And some believe that it could be longer, but for 90 days, you have that immunity. But only after your acute infection. So antibody just tells me you had an infection in the past, but it doesn't tell me whether you're immune right now. It doesn't give me the date.
Okay. And then the last question right now anyway, and is could you repeat the information about asymptomatic spread in Hoosiers?
Yes, so we believe this is a prevalence study that was done by a Dr. Menachemi out of IU School of Fairbanks Hospital. It was a study, I believe, that the governor had contracted with the IU Fairbanks School of Public Health to just look at trying to see how much infection do we have in the state of Indiana over a period of time. My understanding is they found out about 40% of individuals were infected with COVID-19, but were unaware, had no symptoms, looked great, felt fine.
Great. So I think, Dr. Caine, we're going to end it up with that then. I really appreciate, and I'm sure all of us appreciate that you spent the time with us today. Like I said, I learned a lot, and I'm sure everyone else did. Did you have any last comments before I do my closing of the convention?
So let me just say, neighborhoods, you are the heart and soul of our cities, okay? If there are things going wrong in the neighborhoods, we're going to hear that outcry from you. And that's because you live there, you reside there, you care about what happens. And so we need your voice. We need your advocacy. And we definitely need your leadership because we want to have strong, vibrant neighborhoods, but we also want to have safe neighborhoods. And so continue to do the work that you do. Let us know when we're not being accountable. I need those bright minds helping us work on these critical issues for our city because we want the future generations to be able to say, wow, this is one of the best cities in the country I've ever visited, but more important than that, that I live in and I'm a part of the decision making, what happens in our community. So thank you again, Mari.
Thank you.
I appreciate you. Okay.
Thank you. I appreciate
All right.
you. Okay, so thank you, everyone. I want to also thank Deputy Mayor Thomas for joining us today, and I'm sure you'll all get to know her in the next few months and the next few years.
Hey, can I say something? Miss Thomas is just an incredible person. I knew her when she was young. She's got a fantastic mother, so I know she's got the good genes, and I loved her father, who's not with us today. But Indianapolis, my God, you're going to get a great deputy mayor, and I look forward to continue to collaborate with her because she's got the right genes, but she's got the right heart and commitment to doing best. So HOTSA continues to select good people. So
great. I also want to thank all of the speakers. So, those that are watching, the speakers are volunteers on a Thursday night, a Friday night, and a Saturday. Plus, they had to prepare and they had to deal with me for a few months ahead. So thank you to all the speakers. I want to thank our sponsors. You heard from Citizens Energy Group, our primary sponsor, but our other sponsors are Ascension St. Vincent Hospital, the American Red Cross, Old National Bank, the City of Indianapolis, and the U.S. Department of Housing and Urban Development. So thank all the sponsors. And then behind the scenes, we're hosts. Every single session had to have a host that was also a volunteer. So I want to thank all of them. And finally, I want to thank everyone that attended Neighbor Power. Who knew that Neighbor Power 2020 was the last in-person event that INRC would have? And we got here. We had another Neighbor Power in 2021, and it sounds like we'll have a real in-person Neighbor Power in 2022. So thank you very much. That's the end of our program, and I'm going to stop the recording and close out.